I hope you had a chance to reconnect with colleagues and friends and maybe met some new folks from our department that you hadn't met previously. As mentioned earlier, our former chair, Dr. Michael Kidd, was not able to join us today, but shared the following video message.
Hello everybody. I'm really sorry not to be with you in person today for this year's DFCM Conference Day. I was hoping that after 4 long years away I'd be back in beautiful Toronto with you all, but it was not meant to be. My dear mother passed away last week, and so I'm with Alistair and my family in Melbourne as we prepare to say our goodbyes. To dear Risa and to Alison and to all the conference organisers, thank you for inviting me to send this message. It doesn't seem like 4 years ago since I said my farewells to many of you in person. Some of you will remember coming to the lunch that we held in the conference room at the DFCM offices in February 2020. We had a long table set up and we reflected that it might be the last time that we'd all be able to come together in such large numbers for quite some time to come, as we watched borders start to close around the world and countries move into lockdown, and how right we all were. As many of you know, I was summoned back to Australia in February 2020 to assist with the Australian government response to the COVID-19 pandemic, and in particular to help develop and then roll out and lead the nation's national primary care response to the pandemic. I owe a huge debt of gratitude to David White, who shared with me the reports from the experience of the SARS outbreaks in Toronto in 2002 and 2003, including Ross Upshaw's highly influential landmark report on ethical principles for pandemic preparedness, titled Stand on Guard for Thee. The recommendations from these reports informed my development of Australia's primary care response to COVID-19, and in doing so, helped to save many lives while we also protected our primary care workforce. Throughout the pandemic, though, I was watching you all from afar, reading the monthly DFCM newsletter and having Zoom calls with many of you. And I was so proud, as your former chair, to see how you all stood up at a time when your patients, your communities, and your nation needed you the most. Continuing to turn up to work each day, often at risk to your own health and at risk to the health of your family members. Providing regular care to all your patients, taking on leadership roles for your local community and in some cases for the province and the nation. Adapting to the use of telemedicine to support your patients in isolation, setting up testing and treatment services for those with symptoms, and then the vaccination clinics, ensuring that the people most vulnerable in the community were not missing out on care and public health measures, and providing loving and dignified end-of-life care to those of your patients who didn't survive, and then care to their family members. In short, you're being wonderful family doctors and members of family health teams, and I was especially inspired by the work of our residents and our recent graduates. We don't often receive thanks for the work that we do as family physicians, but I want to say thank you. Thank you from my heart to all of you for stepping up when the people of Canada needed you the most. You're all heroes in my eyes. I also pay tribute to those of our family medicine colleagues around the world who we lost to COVID-19, many who contracted COVID-19 while serving their communities. We grieve their loss and we acknowledge their service. I've also been watching with great pride as some of the little seeds of ideas we planted together when I was the chair have flourished. The many successes that you've had in education innovation and research and quality improvement, the new areas of special focus that we worked on, including the new academic divisions, the strengthening of the support that the department provides to the health of First Nations people, the support to our future family medicine leaders, the global impact that the department has been having through the World Health Organization Collaborating Centre on Family Medicine and Primary Care, led by Catherine Rouleau, your many ongoing commitments to social accountability and equity, diversity and inclusion, and so much more. Congratulations to each of you on every achievement over the past 4 years. I want to say a special thanks to David Tannenbaum, who stepped up when I stepped down. David, thank you, and congratulations on your very well-deserved Order of Ontario medal. And congratulations and thank you to our wonderful Danielle Martin for taking over as DFCM Chair and for leading the department with such distinction. I hope that I can continue to support you, Danielle, in this role, just as past chairs, Lynn and Louise and Walt Rosser and Reg Perkins and the two Davids, David Tannenbaum and David White, provided me with their generous and wise support and counsel during my years as chair. I finished up my role with the Australian Government in the middle of last year, and I now have a new joint appointment with the University of Oxford in the United Kingdom and the University of New South Wales in Australia as Professor of Global Primary Care and as Director of a new multinational research, policy and advocacy centre on the future of health systems, focusing on equity, strengthening primary care, transforming our hospitals, taking advantage of digital innovation, preparing our workforce for the future, making sure that we're prepared for the impact of climate change, but also making sure that we apply the lessons from COVID-19 as we reform our health systems into the future. I'm very keen to share my plans and my early activities with you all. There will be many opportunities for us to work together, either at Oxford or in Sydney. Karen Tu and Tara Kieran have already reached out, but there's a lot of work that we can all do together. But talking about that is for another day. I hope that I can visit very soon, but in the meantime, my very best wishes to all of you. If I can do anything to support you in your work, or if you'd just like to have a chat about your career plans or projects that you're working on, please reach out. I am just a Zoom call away. I was a proud member of DFCM. I'm wearing today, in your honour, my DFCM hoodie. I'll always be a member of DFCM. Thank you all for listening, and I look forward to seeing you on my visit very soon. Thank you.